and I'm here at Bibb Medical Center today, and I'm talking to Chelsea Burnett, who is a registered nurse practitioner on the staff at Bibb Medical Center, and we're here today to talk about something we've heard about, which is infusion therapy for the COVID patients that is being administered in a trial, what I understand is a trial, by one of the pharmaceutical companies. Bibb Medical Center has been participating in that trial, and Chelsea is the therapist or the practitioner who's been doing that. I understand that there's been a lot of success with this therapy in preventing deaths as well as preventing hospital admissions.
Yes, there has been a 100% reduction in deaths so far after getting this medication. There has also been a 75 to 80% reduction in hospitalizations. Currently, we've done 94 here at Bibb Medical Center since December 18th was the first day we did them. None of the patients that I have given the infusion to have passed away, and one went to the ER after his infusion and he was able to go home. So I take that as a pretty big success rating.
So say that again about how many patients you've seen?
94.
94 patients here at Bibb Medical Center.
As of yesterday.
That's a lot of folks.
That's a lot of folks.
Well, I read in a couple of national publications that over 125,000 people had received this same therapy. What's the name of the therapy?
There are two different therapies. One is called Bibb, which the moniker for that is either Eli Lilly, which is the company that makes the medicine, or Bam Bam is what some people call it, because the name is so hard to say. And then there's the combination drug, which is Regeneron. I can't even say those, but it's CNI, but it's Regeneron. They both work similarly. They help the body's immune response to the COVID vaccine. They kind of target the spike protein on the virus itself to help your body's own natural immune system say, that's bad, we need to attack that.
So what kind of patients get this treatment?
We do have a criteria, and so far we have stuck to this criteria. Have to be anybody who is 65 or older, because they are automatically higher risk based on their age. Anyone who has diabetes, high blood pressure, any kind of immunosuppressive therapy like medicine for rheumatoid arthritis or cancer, those are also included. Those with BMIs over 35, they're included in the high risk category as well. We have really stuck to this criteria where it's not just everybody who gets the infusion, because we're trying to keep those that are at higher risk to get sicker, to go into the hospital and not be able to come home, to keep them, keep it available, since it's not available for everyone.
But they have to be diagnosed with COVID before they get it.
You have to have a positive COVID swab.
And be someone who is on their way to hospitalization.
Yes.
But have not been admitted.
You cannot be admitted to the hospital. This medicine has not been authorized for people who are inpatient.
So it's still on the trial stage,
yes.
so to speak. Okay.
It's for those that are able to be at home but are at high risk to go into the hospital.
And the therapy has not, I know I already said it, but it's not FDA approved yet, so it's still on a trial.
It is underneath an emergency authorization. So the FDA said, we see how this can work. We don't have time to do all the studies that we need. Let's just put it out there because it can save lives.
Okay. Now, I think I read that this is done by an infusion. This is not an injection. So it's like a needle in the arm.
Yes, it's an IV. So what the process is I'll talk to the patient's primary care doctor. We'll get their information. I'll call the patient myself and schedule. When you get here that morning, you come around to our ER parking lot and call the number. I go out to your car to get you. You come in, you're triaged. I take you back to the room. I start an IV. We check liver function because this medicine does go through the liver. We just want to make sure that there's no kind of liver function issues. I don't want to cause more harm than good. And then the medicine takes about 20 minutes to reach room temperature. It's mixed. It's an infusion over an hour, and then I monitor you for an hour to make sure that there's no side effects.
Okay. And you've seen no deaths
No
here.
deaths.
Do you know anything about the results from other clinics or hospitals in Alabama?
I believe me and Dr. Meggs talked one day this week, and it was 100% reduction in deaths, and that's what this hospital association released.
In Alabama?
In Alabama, yes.
The number I saw, and this is just a magazine report, was that it was 70% effective nationwide in cutting hospitalizations. Now that was a January article, so.
Yeah. And that's hospitalizations.
Right.
Did that other 30% of patients that got the medicine, were they hospitalized because of other reasons?
Yes.
How late in their symptoms did they get the medicine? Why were they hospitalized? Those sort of things.
Right.
But as far as I know, it's 100% reduction in death.
So this treatment, I guess I'd call it trial treatment. Is that the right word to use, trial treatment?
Yes, sir.
It's available if a patient in Bibb County meets that criteria that you described.
Yes, sir.
And they present it here at the hospital, and you screen them. They'd be eligible if they chose to do it.
You can present here, or if you're a resident and you go to if you go to Cahaba or to a different doctor in the area, have your primary care doctor call us, and I can talk to your primary care doctor, look at the sheet, and if they think it's a good idea, I can call you and you can still get it at our facility. You don't have to be one of our patients. I know we work with Cahaba pretty well about getting those referrals, but it doesn't have to be that you tested or even see us here. We'd love to see you, but we're here for the greater good.
Well, that's pretty exciting news. Now, from what I read, this is the same therapy that some pretty well-known people
Yes.
in the political world took advantage of back in a couple of months ago, including our former president and Chris Christie and Rudy Giuliani. This is the treatment that they
Yes.
were able to get. Is that correct? So you can get it right now in Bibb County.
You sure can.
All right.
You sure
Look,
can.
that's really good news. So, is there anything else about this therapy that I've missed asking about that you want to talk to let people know?
That's all. I think so. The main thing is that if you test positive, the infusion can be given within 3 days of your positive test, or 10 days of symptoms. So it is a time crunch. And if you're interested, have your primary care doctor call us.
Okay, so that's something I didn't ask her. I wanted to hone in on. Even if you're asymptomatic or you're not in distress, you got a positive test.
If you have a positive test.
Then you can still get this therapy before you get in distress.
Yes, if you meet the criteria.
Okay, gotcha. That's important to know for people who are not really in distress.
Yes.
So folks who are listening to this need to hear that part.
Yeah, because you could just have a sinus infection and it not be all that bad, and you're positive for COVID. We want to keep it so that you just have a sinus infection, so you can say, oh, well, I handled it fine, and keep you from saying, oh, well, it almost killed me.
Yes.
So that's what this medicine is for, is to keep you out of that danger zone.
Keep you out of the hospital, especially when you've got those comorbidities.
Yes.
Like some
High blood pressure, COPD, diabetes, kidney problems, any kind of cardiovascular disease. If you're obese, all of those put you in a higher risk.
Okay. Well, while I've got you, can you tell us news or trends or what you're seeing on the treatment front here at the hospital, how things are going at the hospital, and whether we're making any progress
It seems like we're making a little bit of progress. We had a spike right after Christmas around New Year's, which we kind of expected because, you know, you want to get around and see your family even though we tell you not to.
Right.
But I'm hoping that everybody is seeing that, oh, there was a spike. I need to stay at home. I need to wear my mask. I need to wash my hands and not go and see grandma. And, you know, I know it's hard because I myself haven't been around as much family as I usually am. And
Right.
but I think we're on a good trend. I hope the downward trend continues.
Well, that's encouraging news.
Yes.
And I think it's time people start hearing some good news for a
Mm-hmm.
change. So I appreciate your time today. I think this will be good news to get out into the community.
Yes. Thank you
And
for
maybe
meeting with
it'll
me.
cheer up a few people.
I hope so. You know, it's maybe a small dim light, but there's a light at the end of this dark tunnel.
All right. Thank you for what you do and what
Thank y'all.
all of your coworkers do over here every day.
Thank y'all.
Thanks for your time.
All right.